Hi, Deanna here with your January practice building tip. Having an evidence-informed practice is a hot topic right now. I recently watched a webinar on the subject. It was actually for teachers who teach this stuff. That's my bag. But the presenter asked a really good question. They asked, are you still teaching what you learned in school? Now, some of us have been teaching 10 to 20 years, so if we're still teaching what we learned in school, there's a really good chance we're not teaching stuff that's based on the most current research. So we're not really focusing on evidence-informed practice. And that got me thinking, this could be a really good question to ask in this month's practice building video to spark a little bit of research on your part. So, are you still using information you learned in school to design your treatment plans with your clients? Now, if you just graduated recently, let's assume your program was pretty evidence-informed. But if you graduated 10 to 20 years ago like I did, and you're still using that information you learned in school to design your treatment plans, you're probably missing out on the latest research that could really help your clients. So ask yourself this question. Do I know what the research says about the most effective treatments for conditions that are common in my target markets? If your answer is no, or I'm not really sure, you should probably do something about that. Here are 3 things you can do to have an evidence-informed practice. Number 1, read the research articles in your professional publications. These magazines do a really good job of summarizing what the recent research is finding on particular conditions. Number 2, take an online course or watch a webinar on research literacy. These online opportunities can be really helpful in identifying valid research studies on conditions that your clients are presenting so you can be more effective in treatment planning. Number 3, pay attention. You're probably already doing this, but if you're talking to your clients, taking good session notes, writing down what works and what doesn't work, and planning your treatments based on your own personal experience, that's research too, folks. That's called anecdotal evidence, and it counts. Keep paying attention and keep up the good work. Have a good day.